மேம் 95 ஆயிடுச்சு. ஸ்டார்ட் பண்ணலாமா மேடம்? நீங்க
லிங்க் கொடுத்துட்டீங்களா சார்?
லிங்க் கொடுத்துறேன் மேடம். லிங்க் இப்போ தரேன் மேடம். நீங்க ஸ்டார்ட் பண்ணலாம் மேடம். ஒரு நிமிஷம்.
சார்
மேம் ஸ்டார்ட் பண்ணலாம் மேம். நீங்க
ஸ்டார்ட் பண்ணி
லிங்க் தரேன்.
லிங்க்
ஒரு நிமிஷம். இந்த லிங்க் அனுப்பிச்சிட்டு வந்துடுறேன்.
ஓகே ஓகே.
பேசுறது கேக்குதுமா? பேசுறது கேக்குது.
Sir, somebody is asking for YouTube link.
That's what he is sending, ma'am.
மேம் நீங்க ஸ்டார்ட் பண்ணலாம் மேடம். ஒரு நிமிஷம்.
லிங்க் சார் அனுப்பிச்சிட்டிங்களா?
லிங்க் இதில் அனுப்பிச்சு மெயில் அனுப்பிச்சிருக்கேன் மேம். இப்போ உடனே இதில் வாட்ஸ்அப்பில் அனுப்பிச்சிருக்கேன். நான் ரெக்கார்டிங் பண்ணிடுவேன்.
சரி சரிங்க சார்.
நீங்க ஸ்டார்ட் பண்ணலாம் மேம். நீங்க
பண்ணலாம். Happy morning.
நீங்க ஸ்டார்ட் பண்ணலாம்.
Yes sir. Very good morning.
ஓகே.
Happy morning to all of you. A warm welcome to all the participants for the second day of the webinar on health, fitness and rehabilitation. I extend my hearty welcome to today's resource person, Dr. Grace Helena, Professor and Head of the Department of Exercise Physiology and Biomechanics, Tamil Nadu Physical Education Sports University, and professors, assistant professors, associate professors from various colleges and universities, and directors of physical education from various colleges, physical education teachers, and director of physical education from various schools, sports trainers, coaches, and other scholars and learned scholars and from other fields. I take this opportunity to introduce today's resource person, Dr. Grace Helena, Professor and Head, the Department of Exercise Physiology and Biomechanics. She has completed her UG in 1984 and BPed in the year 1985, MPed in 1986 and MPhil in 1993, and she has completed her PhD in the year 1998. She has also completed MSc Fitness, Exercise, Rehabilitation and Nutritional Care in the year 2005 and MSc Yoga Therapy in 2012. And she has completed her certificate course in aerobics 2002 and level 1 kinanthropometry in 2009 and level 2 kinanthropometry in 2010. She has started her career as physical education teacher at SBOA School and Junior College from 1986 to 1989. She has worked as a reader cum lecturer and YMCA College of Physical Education from 1989 to 2007 and professor and head the Department of Exercise Physiology, Nutrition and Biomechanics at Tamil Nadu Physical Education Sports University from 2007 to till date. She has worked as a director of distance education from 2009 to 2011 at TNPSU and acted as a vice chancellor in charge from 2012 to 2014 at Tamil Nadu Physical Education and Sports University. And she has acted as an editor in the Journal of Physical Education, Sports and Allied Science at Tamil Nadu Physical Education and Sports University. She has been awarded Kalai Mamini for Physical Education from Dr. Navaraj Chellaiah Trust in the year 2013, an Exemplary Service Award from National Council of YMCAs of India in 2015, and Yoga Padma Shri from Patanjali College and Federation of Yoga in the year 2018, and Best Professor in Exercise Physiology and Biomechanics from Devang Mehta National Educational Awards from 2019, and Best Professor Award in Sports Science from Patanjali College and Federation of Yoga in 2020. She has organized, attended many national and international conferences, many seminars and workshops, etc. And she has acted as resource person and chairperson in many national webinars and conferences in the digital platform. And she has visited so many countries like Liverpool, London, USA, Paris, Dubai, and presented papers at international level. So on behalf of the Department of Physical Education, Health Education and Sports, Queen Mary's College, I extend my hearty welcome to the great personality, Dr. Grace Helena ma'am, to take over the session. Thank you. Ma'am?
Thank you, Uma, for your kind words and a nice introduction. And a very good morning to all the members, those who are present here in this platform. A warm welcome is extended to all the participants from India as well as from abroad. To mention Dr. Mahendran Appukutti from Malaysia, and Mr. Sujit Kumar from Dubai, and other persons from all over India and as well as from abroad. So I am so happy to be here today, and congratulations to Dr. E. Uma for your enthusiastic effort in conducting this webinar to a grand success. Started with yesterday and 2 more days to go. And yeah, you are a brilliant person working in the Department of Physical Education at Queen Mary's College. And we know your hard work and enthusiastic work in each and every activities. Continue to do for the good cause, for the sports especially. And I do thank the principal in charge of your college, Dr. Varalakshmi, for her wonderful speech in the inaugural day yesterday. And I too congratulate for the wonderful presentation Dr. Jyoti who was given yesterday regarding the exercise and diet and physical education on the whole. So today I'm here to speak about the sleep and fitness. So shall I share my slide?
Okay, madam. Okay, madam. Share.
Yeah. Can you see?
Yes, ma'am.
All right.
Yes.
So today I'm here to give you for maybe a 45 to 1 hour of lecture on sleep and fitness. So as Dr. Jyoti was giving you elaborately yesterday regarding the exercise and diet, and the third leg of wellness or fitness or health is sleep. So I thought of giving the sleep separately for you all. So everybody knew that sleep is very important for an individual on the whole. So what is sleep and how it has to be, and what kind of sleep stages and types and etc., and what are the physiological aspects behind. So I wanted to share about these things in front of you. So so shall I proceed with the next slide? Okay. I'm as Uma was telling that I'm Professor Grace Helena, working in the Department of Exercise Physiology and Biomechanics at Tamil Nadu Physical Education and Sports University. So great greetings from the Tamil Nadu Physical Education and Sports University. All right. So we should understand what is sleep, the meaning, the word, where it has come. The word somnolence is derived from the Latin word somnus, meaning sleep. All right. Here, what is sleep? First of all, you have to understand sleep. When we do exercise, our body, the whole body is involved in exercise. Whatever the activities we take part, our cells are repaired. The micro trauma occurs in the cells. So these cells has to be recapitulated or repaired, and the muscles has to build up. So for this reason, and again, when we do exercise or activities or any kind of activity, we spend a lot of energy, fuel from our body. So all those things has to recover. So this recovery process is taking place only through sleep. So that is why the slide speaks about sleep gives our body time to recover, conserve energy, and repair and build up the muscles you worked during exercise. So when we get enough and good quality of sleep, the body produces growth hormone. All right. Now, before going into this particular slide, I wanted to tell you that the sleep plays a vital role. And as we all know that the natural sleep cycle, which is consisting of the awake period, and the sleep. So together, wake period in the day and sleep at night, together it is said to be the sleep cycle, natural sleep cycle. That is why we insist that sleep has to be during the night, and during the daytime we need to wake up and do all kinds of work. Right. Now, this picture shows that the exposure to light stimulates a nerve pathway in the retina of the eye, where it goes again, triggers to a special center in the brain called suprachiasmatic nucleus. This SCN, suprachiasmatic nucleus, is a vital part where we need to understand what is the suprachiasmatic nucleus. Thus, this regulates a pattern of activities that affects our whole body, such as it releases cortisol. Cortisol is very, very important for metabolic activity as well as controlling the sugar. So here it stimulates the hormone for all kinds of many activities in the body. It also releases another hormone called melatonin in the body. So this melatonin is released by the pineal gland in the brain. Now I'll show you in the next slide, pineal gland also. So when darkness occurs, this melatonin stays in the blood, in our blood, for 12 hours throughout the night. And when daytime occurs, the pineal gland shuts down the release of melatonin. So there will not be any melatonin in the blood during the daytime. So the next slide, let me go, is, see, look at that, the picture. The first one says about exercise, nutrition, and sleep. All these three forms of health as well as wealth or the fitness, whatever you would like to say, these three are very, very important. As already taken by these two by Jyoti, and I am going to deal with the sleep. And without sleep, we are not going to say that fitness routine is fulfilled, right? So as I told you earlier, the pineal gland, which is in the brain, which releases the melatonin, so that controls the sleep pattern. So this level increases in the night only. So during the sleep, so this melatonin only makes us feeling sleep first of all. So while we are sleeping, the pituitary gland in the brain, that releases growth hormone, where it helps our body to grow and repair itself. So this melatonin works together with the body's circadian rhythm. What is that circadian rhythm? The circadian rhythm is a body's internal clock. So we have 24 hours of clock outside, and the internal clock is also there. This internal clock, which helps in sleep, when to sleep, when to wake, and when to eat. All these things are happening only because of this circadian rhythm. And this melatonin also helps to regulate our body's temperature, blood pressure, and hormone levels. So always we need to understand, when a great sleep when we have, we will work for so much of hours. That is better exercise we will do. And when we do better exercise, we will get great sleep. Okay, what causes the sleep deprivations? First, not enough time to sleep, and excessive worry, stress, anxiety, depression, repeated awakenings, working at night, travel, medical illness, sleep disorders, insomnia. I'll come to later this insomnia. And what are the long effects of sleep deprivations? Here there are so many issues given, health issues like hypertension, heart attack, weight gain and obesity, diabetes, depression and anxiety, and faulty brain functions, memory loss, immune system deficiency, decreased fertility, and psychiatric problems. All those things can be possible because of this sleep deprivation. Okay, now I told you sleep deprivation, and with this sleep deprivation can accumulate. See, when we postpone the sleep, right, the sleep deprivation accumulate like a debt, sleep debt. And this debt is similar to the financial debt what we have. Suppose some financial debt comes in and it goes and goes on, and we are not able to pay back in a large amount. Like the same, the sleep deprivation also can accumulate and sleep debt occurs. Why and how it causes. What is the cause behind it? Lifestyle, medications, medical conditions, sleeping disorders. So these are all the important aspects when we talk about the sleep deprivation. When we are not enough time to sleep, how we are cheating. We are cheating. So, though we are trying to sleep, but we are cheating, and we are not going to sleep at all, so that the sleep deprivation is accumulated. And excessive worry means we are always we are having thoughts during the bedtime, and that interrupt the sleep. Then the stress, anxiety, depression, diminishes the quality of sleep. And repeated awakenings also. During sleep, there is a noise, there is a light, there is an uncomfortable environment. So that also repeated awakenings taking place. And working at night, that means we are throwing off the sleep pattern, and we are working at night, so that we are fighting against the natural sleep pattern. That is why the sleep is not coming at night. And the travel also, traveling across the time zones, that also interrupt the sleep patterns. Then the medical illness, that also causes pain and so many things, breathing, difficulty in breathing. Those kinds also will cause the sleep deprivation. All right. What are the symptoms of sleep deprivation? As I told you, fatigue during the day. Fatigue during the day. If there is a fatigue, we cannot do any kind of activity. So fatigue, then the lack of energy, mood changes, social problems, lack of concentration, and fatigue while driving. So apart from that, there are two more things, that paranoia and hallucinations. So these things are possible common sleep deprivation symptoms. So hallucinations, you all know that we'll sit here and we could see some other light, or like an object, or like a person standing in front of us. Those things could be possible because of these sleep deprivations. And what are the consequences behind it? When we don't have proper sleep, the consequences are increased risk of accident and injury, and physical health changes, and the job performance, where we cannot perform any kind of activity, including our job. Okay, so because of sleep deprivation, I said the fatigue occurs. All right. So in US, they have studied that in 1 lakh people, the police have reported in highway crashes where 71,000 are injured and 1,500 are dead in US because of drowsiness, and it is said to be a silent killer because there is no sleep. In India, the same way, 1.5 lakh people die in road mishap, and some of them due to drowsy and sleep driving. That is why these accidents happens. All right. So this fatigue, which increases the stress, anxiety, depression, and also the mood, irritability levels, and our personal relationship is hindering. And this fatigue also diminishes the muscular strength and muscular endurance, and also it diminishes or effect on immune system, and it puts in risk factors like risk for infections like flu, cold. All these things are happening due to non-sleep. Right. Then how we are going to fight against the fatigue? This poor sleep habits is one of the most common problems in the society. Everyone knows about it. What are the examples of this? This is overstimulating ourselves in night with the television, seeing the TV, or working with the computer, or stay up too late, and waking up too earlier, or interrupting the sleep with medications, chemicals, or caffeine. And all these things are poor sleep habits, where these things has to be changed. How are we going to fight against this fatigue? Put the focus on our personal habits, one. Secondly, a sleeping environment. And thirdly, getting ready for bed. So these are all the personal habits. Now, what is next one? The personal habits itself, we need to go think about determining a set bedtime and awakening time. What is there? The body becomes accustomed to falling asleep at a certain time. Suppose I'm going to sleep at 10 o'clock. 10 o'clock is accustomed my body. So try not to allow your bedtime to drift later and later. So thereby the sleep debt occurs. Accumulation takes place. So set yourself to a scheduled time to go to bed at waking time. And avoid napping during the day. So many people are having the habit of having napping during the day. After lunch, they will go for sleep, 1 hour, 2 hours, or half an hour, and so on and so forth. So when we work also, we get sleep. So during that time, please avoid that napping and get up from your place. Just walk for a little while and stretch yourself around your desk and drink water. Then you will get rid of those sleepiness, so that absolutely you are free. If at all you wanted to have absolute nap, go for 10 to 20 minutes, that's all, not beyond that. So avoid alcohol and coffee and exercise regularly, consume a healthy diet. So these are all the personal habits to be modified, or our lifestyle modification in a personal habits, right? Now, coming to the food for fuel, I'm not going into deep as a food. This food is for sleep only, sleep, right? What we choose as a fuel is going to absolutely impact on the performance of our body. Where the balanced diet we need to take, as you all know, carbohydrate, fat, protein, minerals, vitamins, everything is important, including water. So I'm not going into detail with that. And my food pyramid suggests that the whole grains, make half of your whole grains and varying veggies, focus on fruits, get your calcium rich foods, and go lean protein, and find your balanced food and physical activity. So all these three things, one side is a food, another side is an exercise, another side is a sleep. So all things are equal importance. So I have to concentrate on diet also for better sleep. All right. Now coming to the next slide, how long we need to sleep, right? As per the Center for Disease Control Board, they are suggesting that we wanted to be healthy, safety, and performance oriented. We need to have a certain kind of sleep, certain amount of sleep. See, look at the picture. It says this is the normal sleep time, right from the neonatal to the elderly adult. It is every stage it is given over here, the maximum time and the minimum time. And you can see this chart and where you are with this chart and how you can compare it with your sleep hours with this chart. So that will give you an idea, the guidelines, as recommended by the Center for Disease Control Board, and we can have our sleep time, and this is given by them so that it will be helpful for us to have a better sleep. And now the next slide speaks about the sleep fitness, the effect and benefits in health, safety, and performance. When we have only a short durational sleep, it has got a big impact on us. See, look at the picture, how she is. See, look at the eyes, look at the face, how it is turned up when there is no sleep. See, it affects the health, mood, appearance, performance, and safety on the whole. So it affects. So when we have a very little amount of sleep, it has got a high impact on obesity. Obesity, there are so much of percentage on obesity, diabetes, and sperm count, and stroke, breast cancer, heart disease, and even death. 20% in 20 years itself, it is dead. And loss of attractiveness, and hungrier, and accident, and catch cold, and focus and memory is lost, and mood and emotion, and brain tissue itself loss. So these many problems occurs when we do not have enough sleep. So the short sleep has got a high impact on our health, mood, appearance, and performance, as well as the safety. The next slide speaks about a good sleep, a great benefit on performance. All right. So, first of all, the in safety. When we have a good sleep, and automatically we will be alert, and the judgment will be proper, the reaction time will be better. So, we'll be always safe. And when we come to work, we will be energetic, and the drive will be always there, and our mood will be very good. The patience, the focus will be always there. Creativity. So always in work, we should have some creativeness. So that creativity will be enhanced. The judgment will be proper. The decision making, especially in brain, if decision making process is happening, and working memory, earning capacity, all is increased because of good sleep. And coming to the sports where attention is important, focus is important, judgment is important, and the reaction time is also important. So these are all enhanced. So these are all improved in the sport where it is necessary. And due to that, the recovery time is also improved, so that our the endurance capacity is increased. Thereby, we can do a work for longer period of time without fatigue. So that is regarding performance oriented. Now coming to the relationship oriented. When we have a good sleep, the benefits are very, very high. Look at the picture itself. It says how it is, how she is smiling. See, look at the appearance, the appetite, the beauty, energy, health, weight, everything is normal. So in relationship, the friendship also is enhancing, and a better friendship happening, attention, focus, judgment, making and differences, all are there, all are developed. Especially for school children, the IQ level is increased, attention, learning capacity, the problem solving, motivation, the internal motivation for children, and the grades will improve, scholarship they will get it, and they will work towards salary. Then the family, each and every family, we are having the relationship one way or other as a husband and wife, or children and parents, and so on and so forth. So here, in the mood, the patience, the judgment, energy, decision making, memory, sex, everything is improved because of a great sleep. So good sleep will help in the great benefits in relationship. Now coming to the longevity. Here, a good sleep extends the longevity. Always when the brain is fit, brain fitness matters for everything. So in the performance, why they say. So when we compare the age and performance, where from the child age to the elderly people, it improves the performance because the brain fitness matters. So when we have a good sleep, it extends the longevity from here till the older people, where they delay in diseases. So diseases, as I told you, so many diseases in the beginning. So these diseases are delayed process happening, so that the longevity extends. The next slide speaks about common sleep disorders. You all know that stress plays a vital role, and insomnia. Insomnia will come later. Now here, the modern stress, there are so many stress comes in modern way of life. We are facing it more stress. So that contributes to poor sleep. And in earlier days, our fight and flight response was for survival, but now it contributes to diseases. What is that fight and flight responses? The sympathetic nervous system stimulates the adrenal glands, triggering the release of catecholamines, which include adrenaline and noradrenaline. This results in increase of heart rate, blood pressure, and breathing rate. So this is a fight and flight response, where in once it was for our survival, but now because of the modern stress contribution, and we are in stress, and it leads to diseases. The next slide speaks about, see, look at the picture, the common sleep disorders. If we don't get proper sleep, we will get I said, the weight gain, the obesity, etc. So the diet, medication, and metabolism. Here, it has got an impact, high impact. Sleep impacts on diabetes and glucose metabolism. See, during the sleep only, our brain functions, or brain pattern is working properly. So the brain, for the only source of brain, the energy source is glucose. So improving insulin signaling improves sleeps. So for sleep, we need this glucose for brain to work during the night. So during the sleep, as far as the control disease, Center for Control Disease Board, they say that this improving insulin signaling improves sleep. Now, the doctors say that when we go to doctors, if we are not getting enough sleep, the doctors will prescribe you medicines. So those medicines are dangerous and side effects may occur. So apart from that, what is the natural solution? So the natural solution is the third leg of wellness. So as I told you in the beginning slide, exercise, nutrition, and sleep, all three are equal importance for an individual to be a healthy, fit, and without any diseases. Right. Now, after understanding what is sleep and what are the symptoms of sleep and causes of sleep and so on and so forth, we are coming to a particular thing that is in the physiological aspects. We have two types of sleep. One is a rapid eye movement sleep, REM. And the second one is non-rapid eye movement sleep, which has got different stages in it, between the rapid eye movement and a non-rapid eye movement. This is linked with specific brain waves and neuronal activity. So these are all the two types of sleep, where REM and non-REM. Okay, so a sleep cycle consists of 5 stages. There are 2 types and 5 stages. It rotates between non-REM and REM. It includes first drowsiness we will have, then the light sleep, then it goes to moderate sleep, and from moderate to deep sleep, and from deep to deepest sleep, and the dreaming comes in. So these are all the 5 stages of a good sleep cycle. This is called a good sleep cycle. What is the stage 1 of a sleep, where it is also known as the transitional phase, where it occurs when one finds themselves floating in and out of consciousness, and during this non-REM stage, one may be partially awake, but while our minds beginning to drift off. So where the drowsiness comes in, and the drowsiness eventually leads to light sleep. So the first stage occurs. Now, what is the difference between this deep sleep and REM? So if deep sleep is for our body, then REM is for our brain, as said by Granner. So REM, rapid eye movement, is an important stage for our brain activities. So the deep sleep for our body. So actually, this it is so inactive, where our body becomes paralyzed during REM, rapid eye movement. And this rapid eye movement, when most dreaming happening, and our eyeballs moves rapidly in all directions. That is why the name said to be the REM, rapid eye movement. So during this stage, our heart rate is increased. Our breathing becomes more irregular. So this is called the difference between deep sleep and REM. These 5 stages of sleep together, that means two types of sleeps make a cycle, single cycle. So where our brain progress sequentially. I told you brain works during the sleep. So our brain progresses sequentially through each stage of sleep. That means from wake to light sleep to deep sleep to REM. And the repetition takes place. It repeats and repeats throughout the night, throughout our sleep. So awake time means when we are spent in bed before and after falling asleep, and it also includes some brief awakenings during the night when we go to bathrooms and so on and so forth. So that also called as awakening time. All right. Now, physiologically, the sleep is considered as restorative or recovery phase. So our body prepares for the next episode of wakefulness. That means today is a day, tonight if we sleep, and the next day we need to get up. So for that, the sleep helps us. So cell divisions are more rapid during the non-REM. Non-REM, during that stage only, a cell division becomes more. So sleep has got an important function in our immune system also, physiologically. So as I was telling you earlier, the circadian rhythm, the 24 hours of clock, where this circadian rhythm helps collectively the rhythm which is called as physiology, rhythm in physiology and behavior. The control of sleep from wake cycle, and it modulates physical activity. This circadian rhythm helps in modulating our physical activity, our wake cycle, our food consumption, and the course of the day, regulate the body temperature, heart rate, muscle tone, hormone secretion. Everything is regulated and modulated by this circadian rhythm physiologically. Why do we yawn? Everybody, we are doing it. Yes, as an often, even in the daytime also we yawn. Why we do yawn? So to see, always we breathe in and breathe out. So deep breathing and breathe out is also taking place. So when our body becomes tired, fatigued, during that time, the less oxygen supply is there. So breathing becomes slow downs. So during that time, yawning helps in bringing more oxygen into the blood and more carbon dioxide outside the blood. So there comes yawning. So yawning helps to bring oxygen more in and take out carbon dioxide more from the blood. Breathing while we sleep. How this breathing occurs while we sleep? See, in the upper jaw and the upper throat, the muscles are relaxed during the sleep. Now, these tissues block the airway. So once it is blocking, so the breathing stops. That is called as apnea, sleep apnea. You would have heard about it, apnea. So when one has an apnea, the loud snoring comes in. The snoring, that is called obstructive sleep apnea, OSA, obstructive sleep apnea. So this is squeezing the airway, narrowed. The next slide, I'll show you how it is narrowing the blocking the airway so that the snoring comes out. What are the warning signs of sleep apnea? The loud snoring or frequent snoring, then silent passing in breathing, choking or gossiping sound. Somebody will have this kind of gossiping during the sleep, and daytime sleepiness or fatigue, and refreshing sleep, insomnia, morning headaches, and nocturia. Nocturia means walking during the night, going to the bathroom, and so on and so forth. Now see, look at the picture. The main cause of sleep apnea. Why it causes, how it causes. See, because of weight and obesity. All of us are more weight, excessive weight, and obese. So this only obstructing our air pathway so that the sleep apnea comes in. So how it is associated with soft tissue of the mouth. Look at the picture here. The tongue, this is a tongue, lower jaw, the upper jaw, this is the airway. see the airway. When this during the sleep apnea, this is obstructing during sleep, where the muscles are relaxed, so that this tongue and surrounding tissues fall backs. It fall backs into the throat area and obstructing the airway. So when the obstructing, the flow of air is obstructed, automatically the snoring comes out. So the apnea, that means the breathing, it stops the breath. So that is happening because of the blockage in the airways. So this is happening. This is called as sleep apnea. Then this sleep apnea, in the next slide, speaks about sleep apnea, which system it affects. Because of the obesity or overweight, our circulatory and cardiovascular system affects due to sleep apnea, because the blood pressure becomes higher due to obesity, and it also the sleep apnea helps in health risk factors, and it has got like a arterial fibrillation. The rhythm, heart rhythm, arterial fibrillation occurs, abnormal heart rhythm, and increases risk of stroke. So these things are possible in circulatory and cardiovascular system. It is all because of obesity, because of overweight. So we need to concentrate on exercise, diet, and sleep. So when these all three things are proper, automatically there will not be any sleep apnea. There will not be stop in breathing. So all these tissues becomes easier. In the next slide, I'll show you how this device helps in for sleep apnea. And what are the lifestyle remedies for this? I told you, you need to maintain a healthy weight, and doctors will always say you that sleep apnea is there, you need to lose weight. And try going for yogic exercises or yogic postures and regular exercises. And we need to strengthen our heart, and the heart should pump enough, blood circulation should be there, energy level should be boosted with the proper diet. And we need to alter our sleep position and avoid alcohol and smoking, so that this sleep apnea will get rid of. And look at the picture here, the best treatment for sleep apnea. This is the device where we can have it in the nose. There are different kinds of devices are available, and in the nose clip is there, as well as in the mouth clip is also there. This is said to be the continuous positive airway pressure therapy. Continuous process airway pressure therapy. Here, this treatment is very good for sleep apnea. This mask, it may be in the nose or in the mouth. As I told you in the earlier slide, there is a block in the airway. Here, look at the tongue, look at the lower jaw, upper jaw, the airway. When this is been attached through mouth or nose, and thereby this upper jaw, and it opens up the airway, thereby from the epiglottis, all the airway, the pathways are opened up, so the air flows properly and we can breathe easily during sleep. And this is one way of treatment. It is a highly effective treatment for sleep apnea. Then how many hours we need to have this CPAP? So the CPAP, as per the studies have proven, that at least 6 hours of CPAP is important. We need to use per night, and to reduce this sleep apnea and the health risk factors of obstructive sleep. And also we need to encourage the patients should have this CPAP during the night. And now coming to the whether the stress causes sleep apnea. Of course, the stress causes, or stress and anxiety may cause the sleep problems, and the existing problem becomes worse, because the anxiety, it exacerbates our problem. And also the sleep disorders like sleep apnea, loud snoring, and obstructive airways, and sleep walking, narcolepsy, and falling sleepy always spontaneously, even during daytime. Whenever somebody lies down and they will sleep. Whenever somebody sits on the sofa or somewhere and they'll sleep. So these things are possible, and that is because of stress and anxiety. And what happened during the sleep apnea is left untreated. So if we are not treated the sleep apnea, and there are serious problems, consequences we will come in. That is high blood pressure, heart diseases, stroke, and accidents, and also diabetes, depression. All these things, ailments are possible when it is left untreated. And so we need to be very, very careful. Even we have sleep apnea, we need to be treated that properly. And this sleep apnea, what is does sleep apnea happen every night? One can ask question whether it is happening every night. It is definitely, it is a serious sleep disorder. Every night it may happen. And sleep apnea means it stops breathing for 10 to 30 seconds at a time. So one time it stops our breathing for 10 to 30 seconds during our sleeping, and it happens 400 times every night. So look at that, 400 times every night, this sleep apnea, 10 to 30 seconds of stop of breathing happens. So it is very, very dangerous and serious sleep disorder. We need to be very, very taken care of, and we need to go to doctor and psychotherapist and so on and so forth, so that our stress and anxiety level becomes down, and we'll get nice sleep. And whether in sleep we can what can happen during this sleep apnea is untreated. Let's say during non-REM, we breathe slowly and regularly. During REM only, the breathing rate goes up, heart rate goes up, and so on and so forth. Here, breathing also becomes normal and shallow and regular during the sleep phase. So, breathing is important while sleeping. So, somebody will have irregular breathing, somebody will have gossiping, somebody will have a regular breathing, and these things are occurring in the stages, stage-wise, in non-REM and REM. Non-REM is a breathe slowly, regularly, and in REM, breathing rate goes up, heart rate goes up. So what occurs during REM? In REM stage, as I told you, it is a fifth stage, and it is characterized the eye movement and increasing the respiratory rate and the brain activity. Brain activity is increased. So during this time only we get dreams. So dreaming occurs because of increased brain activity. And at time, our voluntary muscles, our arm muscles, leg muscles becomes paralyzed. So you could feel that numbness. You could feel that numbness and paralyzed arms and legs. That is called voluntary muscles are become paralyzed during this REM sleep. But the brain activity is more, so that the natural process which are happening in our body is normal. So I wanted to bring this slide before going to the other slide. Why? Because we will learn thoroughly what it is in the next slide. So what are the emotions we store in the liver? We store anger, resentment, frustration, irritability, bitterness, flying off. All those things will happen. These are all emotions which we store in the liver. What is the function of liver? It involves in smooth flow of energy and blood through the body. And it also regulates and secretes, stores blood, and is also connected with tendons, nails, eyes, everywhere it is connected. So the secretion of bile for proper digestion, it's also happening in the liver. As you all know, the liver plays a vital role for all these functions, and it also stores these emotions. Now, see, look at this slide. what is happening between 1 to 3 a.m.? It is more active. The liver is actively taking part during this time. 1 to 3 is meant for liver, where when our body is sleep at that time, during that time, toxins are released from the body and fresh new blood is made. So that is why liver plays a vital role, and the sleep, the importance of sleep between 1 to 3 is very important, especially the liver is concerned, and here the toxins are released and new blood is formed. And now remembering the dreams. So basically there are so many theories suggest that dreams occurs when our brain is processing informations, eliminating the unnecessary stuffs. Whatever the unnecessary stuffs in our brain, it eliminates. And the short-term memories become long-term memories during this sleep. So the people who recall dreams, the dream occurs during the REM. So that time the dream occurs. See, those dreams, those who are recalling the dream during the waking time, and they will have a difference in their ability to memorize things in general. Now, is it good for sleep? You can ask a question called dreaming is a good sign for good sleep. Yes, of course. Dreaming is a normal and healthy part of sleeping. In sleeping, dreaming is an important one. It's a last stage. And the dream is when we have a series of images, stories, emotions, feelings, all these things are throughout the stages of sleep, it occurs. So this dreams that we remember during the REM sleep cycle, so where the brain is very actively taking part, and when the more memorable dream happens during this time. Why do we feel sleepy? You can ask question that also. So the studies have proven that it is known as sleep pressure. So many studies have pointed out that adenosine, you all know adenosine is a chemical compound which triggers for sleep pressure, where the chemical, this accumulates during our waking hours, this accumulates in the brain. So eventually it helps in stimulating the unique pattern of brain activity that occurs during the sleep. So that is why the sleep plays a vital role for our brain, and the adenosine is a chemical compound which only here helps in stimulating all kinds of unique pattern of sleep and brain activity. All right, why do we sleep? Why we need to sleep better? So as I told you earlier, it is for amazing memory power to increase, and sleeping improves the heart, and sleeping decreases depression, and sleep increases creativity, sleeping supports weight loss, and sleeping makes you healthy. So for all these reasons, we need to sleep better. So I have shown you different slides also in the beginning. To sleep, the better sleep helps in personality, better sleep helps in appearance, and so work, and all these things. Like the same here, we need to sleep better for all these qualities to be improved. And how can I fall asleep within 10 seconds? One can ask questions. So this is called military method of sleeping, where you need to relax entire face first, and including the muscles inside your mouth, and drop your shoulders and release the tension in the chest, and let your hands drop down sideward. So exhale and relax your chest, relax your legs, thighs, calf muscles, etc. And clear your mind for 10 seconds by imagining the relaxing scene, so that you will fall asleep. So this is one method of sleeping within 10 seconds, how you can fall asleep. And what best treatment for insomnia? Insomnia is basically, it's also one of the sleep disorder, where cognitive behavioral therapy for insomnia is a very good treatment. Instead of sleep medications, you can go to psychotherapy therapist, and where they will have a cognitive behavioral therapy about this is insomnia. There are so many techniques they have to relieve all these kind of sleep dementias, where the relaxation techniques they will teach you, the deep breathing capacity, coping self-talk method, all these things they will have, so that this is a very, very important treatment for insomnia. What is the best cure for insomnia? There are two things. As I told you in the beginning, one is melatonin, which is released from the pineal gland in our brain, and that helps in for the proper sleep and the pattern of sleep. It increases. But that is one. Second one is valerian, where this is a herb. It's a mild sedations which affect in good sleep. And how do you make someone fall asleep instantly? Instantly means there is another technique. I'm now going to teach you this kind of technique. Don't fall asleep. I don't think so, because it is a morning hour, daytime, so you don't fall. So please, all of you, keep your tongue first. No, you place the tip of your tongue behind your upper throat, that is front of the teeth. Then exhale completely through your mouth, and make a whoosh noise, and close your mouth, inhale through your nose, and count mentally 1 to 4. Then hold your breath, mentally count to 7, 1 to 7. So this is one method of falling asleep instantly. If you are not getting sleep, you can try for this kind of technique where you can fall asleep. So this will help you for better sleep. And somebody can ask question that, okay to sleep late and wake up late. No, not at all. See, suppose I'm sleeping for a particular time and waking up in a particular time, it has to be regularized. Sleeping late and waking up early, it's also disrupt our health point of view. So where during the weekends, Saturday and Sunday, where we are jumping up, like that means in Sundays, having a gala, get together, eating, chatting, etc., and go for sleep late night, and early morning, Monday we are getting up early and quickly doing all kind of work and going. So where we are jumping to one zone to new time zone, where we experience this kind of stress in our body, and it undermines the health. Then why I am so tired on day but cannot sleep at night? Somebody can ask this question also. I'm so tired during the day and I'm not getting sleep in the night. This is called insomnia, and where it is inability to sleep, where it causes stress, jet lag. Somebody is traveling from this country to another country, the jet lag can happen, and health condition, our medication, and amount of coffee we drink. All these kinds of problems will occur for insomnia, and this causes other sleep disorders also, mood disorders and anxiety, depression. All these things are possible, so that we could not able to sleep at night. And can blind people dream? You can ask question. So blind people cannot dream because they have not familiarized with the during the waking time, they are not seeing anything outside, outworld. They are unable to see. Only they can touch and see, but they cannot see through eyes. So that the blind people cannot get dream visually. But the Danish research, they have proved in 2014, they have found out that during time passes, the blind people are less likely to dream as a pictures they can dream. But some people, they are not blind when they born, but later on they become blind, and those people, they can visualize the dream during the sleep. And how to increase this deep sleep? One can ask question. So where a proper diet helps in increasing the deep sleep. As far as the American Sleep Association, they have found out that low carbohydrate diet promotes a better sleep. It increases the sleep, deep sleep, when compared to those ate mixed diet. And also the exercise plays a vital role for increasing the deep sleep. Then how can I sleep deeply without medicine? One can ask question this also. So something you need to do, something you should not do. Stick to your regular time, sleep schedule. And as I told you earlier, all 7 days. And you regularize your exercises all through the days. And plenty of natural light exposure must be there. And establish a regular relaxing bedtime. And take a warm bath and shower before you go to bed. And what happens at 3 a.m.? One can ask this 3 a.m. 1 to 3 is for liver, as I told you earlier. And what is happening at 3 a.m.? It hits right about the time where our body going through REM, rapid eye movement, where the deepest sleep is possible. So where the heart rate slows down, drops down our body temperature, and dulls all the functions if possible, and where we get true deep rest. So this is very, very important, 3 a.m. So the people are working right through night from 1, 2, 3, 4, and so on and so forth. So they will not get this deep rest at all. So once they are not getting this deep rest and they are fatigued, for the next day, they are unable to do all kinds of work. So this 3 a.m. hits right about the time for our body to get deepest sleep. And what are the causes of sleep talking? Somebody will talk in between during the sleep also. They are because of the stress, depression, and deprivations. These sleep deprivations and drowsiness, alcohol, fever, all these things will cause us sleep talking. And because of the family problem, external factors, all these things stimulates our behavior so that we talk during the sleep. And the deepest sleep, as I told you earlier, REM stage is the deepest sleep, where it indicates the 4th stage of sleep, and it occurs approximately 90 minutes after you fall asleep. So first non-REM, then the light sleep, moderate sleep, and deep sleep, deeper sleep comes in, right? So this is the cycle. So REM sleep occurs approximately 90 minutes after you fall asleep. So physiological changes during sleep, our temperature, our blood pressure, all these things, oxygen, carbon dioxide, glucose, all these things are quite constant during the waking hours, during the daytime. But what is happening during the night? Physiological demands are reduced so that the temperature and blood pressure drops down. So this is the physiological changes during sleep. So what to do for better sleep? You can go for so many asanas, postures you can do, like Vajrasana, Suddha Vajrasana, and Pavanamuttasana, Savasana, so many asanas which has been given, and you can do all kinds of yogic asanas or meditation or kriyas, whatever the yogasanas, yoga teachers, or with the yoga, whatever the knowledge which you are having it, you can go about it and you can have a better sleep. And the better quality sleep, one can attain for better fitness is avoid the light, noise, caffeine, alcohol, spicy food, acidic food, and hard to digest food. These food has to be avoided and include magnesium-rich foods, consistent sleep schedule, bedtime routine, exercise, cool bedroom temperature. All these things you need to include for better quality of sleep. And as I told you, you need to get hours of sleep, as I shown you a chart, and where you belong to and what kind of hours you are sleeping. All those things also plays a vital role. Suppose if you are not having inadequate sleep, and that leads to many diseases and increases inflammation, focuses, all these things, impairment occurs in our body. So now come to sleep and immunity. So immunity plays a vital role. Now we are in lockdown, or COVID, and so on and so forth. So virus comes in. So for that, all are saying that immunity has to be developed. So the sleep plays a vital role for immunity, proper immunity. So one who is getting enough sleep will have a proper immunity system. If we are not getting enough sleep, the immune system affects. So both physically and mentally, all health problems we bring in. Now, this is the model of sleep-immune interactions, where the insomnia, primary insomnia, sleep apnea, major depressions, and alcohol dependence. These things will interfere in increasing the sleep disturbances. So it increases the sleep disturbances, where again it increases the pro-inflammatory cytokine levels and production in the body. Thereby, there is an inflammatory and cardiovascular disorders happening, increased inflammatory and cardiovascular disorders in one side. In another side, this sleep disturbances decreases our natural immunity, cellular immunity, so that infections of diseases, it is a risk factor, diseases are happening, infectious diseases are happening. That is why so many people die due to this coronavirus, or they are getting coronavirus because of the natural immune system is spoiled because of sleeplessness, and whatever the amount of alcohol we are taking, and the depression, the anxiety, the stress, whatever the amount of stress we are having it, all those things create a problem in immunity system. So now comes how to sleep. How to sleep, either sideway or in a supine position or in a prone position. What kind of, what type of structure, the posture which we need to have during the sleep, that plays a vital role. Here, when we sleep side, we need to keep the pillow between the knees and prevent your upper leg from pulling your spine and the alignment. So it reduces the stress on your hips and lower back. So pull your knees up slightly towards your chest. So the pillow for your head should keep your spine straight. So the pillow must be there. We need to keep the pillow for our head, and you can have a pillow in between your knees also, so that your spine is straight, and thereby the pulling of spine cannot take place, so the alignment will be proper. Now, see, look at the posture. See, the good mattress is also plays role in keeping a spine aligned. So this is a proper mattress, and this is not a proper one. So that, see, look at the spine, how it is deviated and how it is straight over here. And the next slide speaks about, see, look at that. When we sleep like this way sideward, the arch is there. So that, no, our spine is not in aligned proper. So here, see, look at the pillow which is kept in between the legs, so that the alignment is proper. The next slide, see, look at the sleeping in a supine position, keeping the pillow underneath your knee and for your head, and also sideward, so that a proper sleep without disturbing any kind of ache or pain in the lower back, or especially the lower back will be pain during our sleep. So because of this improper alignment of spine. And these are some positions where we can sleep for our ailments, that is health problems, like shoulder pain, this kind, and back pain, this way, and headache, and sinus problem, and high blood pressure, and this is premenstrual syndrome pain, neck pain, digestion trouble, heartburn. So for all these kind of issues, we can we have to have a proper sleep position, so that we can have a good sleep. And these are all correct postures, so how to sit, how to walk, how to stand, and how to lift the weight and do the work and sleep. All these things, these are proper and these are all improper, so that it affects our or the knee or the spine, and all those things are affected, so that no, we will not get a proper sleep. So the best sleep position is sideward, that is sleep on side, SOS, sleep on side. Even better is to sleep on your left side is better. Why? I will tell you how. The left side will increase the amount of blood and nutrients that reach to during the pregnancy. I'm talking about the pregnancy ladies. They have to sleep towards the left side. Why? Means the blood and nutrients, it has to reach through placenta to the baby. So then for that reason only, they need to sleep sideward towards the left side. Then keep your legs and knees bent and proper pillow in between your legs. That helps for the proper sleep. And where the protuberant of abdomen is there, and so that no, the spine alignment should be proper, so that the baby also should be taken care of properly. So for that we need to instruct the pregnant ladies to sleep left side. And what will happen if I sleep? Somebody can ask that right side, whether it will harm baby during sleeping. So during right side, no, you can, it is a risk factor for the baby, where women who sleep on the right side or back, see back, that means supine position, during the late stage of pregnancy, it is a higher risk of stillbirth. So risk doubles during the last 3 weeks, the months, and compared with those sleeping on the left side. Studies are suggested. Somebody is cracking, I don't know, right? So what happens if I accidentally sleep on my back while pregnant? So if I sleep back, this abdomen is like this way. So the intestine and some major blood vessels are pressure. The pressure, because of my abdomen is protruded, so those weight is pressurizing my abdominal vessels, major vessels and intestine. So there the health problems comes in, and more serious effect over there. So lack of blood flow to the mom as well as to the baby. How long I can lay on my back also they can ask. See, after 20 weeks of pregnancy, we are not supposed to lay down in the supine position. So where so due to weight of your uterus, it can compress the major vessels called vena cava, and thereby it disrupts the blood flow to the baby, as well as there are some discomfort happening to the baby, nauseated, dizzy, and short of breath happens. And does the baby sleep in the womb? Somebody can ask, in the mother's sleep. Yes, definitely. Between 38 and 40 weeks of gestation, and always 95% of the baby sleep inside the womb. And why is sleeping on your left side best during pregnancy? So I said that left side is important to sleep because our major organ is the liver. So the liver is in the right side. So when the right side, your abdomen, when you are lying down in the left side, it keeps your uterus off from the larger organ, so that it also improves circulation to the heart and allows the best blood flow to the fetus, uterus, and kidneys. And if you are a slight sleeper, leave the pregnant ladies. Now, if you are a slight sleeper, always it is good to reflux. It alleviates acid reflux and heartburn, boosts digestion, stimulates the drainage of toxins from our lymph nodes. There are lymph nodes where the drainages are there, and there the accumulation of waste are there. So those things will be drained properly and improve circulation and helps our brain filter our waste. So this is happening because we sleep in a sideway position. These things are important physiologically. And the healthiest sleeping position is, we need to sleep in a spine rest neutral position. So as I shown you pictures, so keep the pillow underneath and in between the legs, so that when you sleep sideward, or when you sleep in supine position facing up ceiling, and where that helps in acid reflux, that is braiding away the acid reflux. That helps a lot. And worst sleeping position is prone position, where we are those who are struggling to sleep, and they can go for this prone position for some time, where you need to keep a pillow on the lower abdomen so that your spine is aligned. And why sleeping our stomach is bad means because the middle part of the portion is only our weight is there, more weight, all organs are embedded here in the mid part, so that it is very difficult to maintain a neutral spine position, so that we are not stressing on the spine, so that we need to always sleep in the supine position or in the sideward position, not in the stomach facing downward or prone position. So better to sleep with pillow. That is more important. Everybody knows that God has given a gift, the pillow. So pillow is very important for us to keep our the spine aligned and neutral. So pillow is very important. So that ends my slide. And I hope that you have understood something regarding the sleep, what kind of sleep, what is the stages of sleep, how it physiologically impact on our body, and what method we can improve our sleep also I have dealt you. So it is in your hand whether you will go for better sleep. And after hearing from my side, and this is the time for asking questions.
Yeah. Thank you, ma'am. Thank you so much for a wonderful presentation.
All the listeners, right?
Yes, ma'am. Thank you, ma'am. So, viewers, it's your time. If you want any queries, you can post it in chat box. Here is a question, ma'am.
Yes.
How can we cure sleep apnea?
How can
we cure sleep apnea?
Yeah, that's what I shown you, different slides for sleep apnea. This due to overweight and obesity, this sleep apnea happens, stop breathing. So for which there are techniques, the device which I have shown you, where this air blockage will be eliminated. So the blockage will be more, the pathways will be, the narrowed pathways is opened up. So that is one way of treatment. Another way of treatment is psychotherapy. That can be possible, and the better diet and exercise. Those things helps for sleep apnea.
Thank you, ma'am.
So we need to reduce weight first of all. All right.
While sleeping, why we have a jerk movement in our body?
Yeah, that is what I said. There are plenty of things are happening during sleep. Somebody will have irregular breathing. Somebody will have gossiping like this way. That is called jerking. See, gossiping will be there, and somebody will have a stop. That is apnea will be there. So many breathing things are happening during the sleep. That is quite natural and normal. And suppose this is irregular breathing happens because of this overweight and obesity.
Thank you, ma'am. Another question. While sleeping, why we are laughing or crying? What is this? Usually babies used to do.
Yeah. That is also possible for somebody. Like I said that somebody will experience, there are dreams occurs, during the REM. The REM time, the deepest sleep, the dream comes, and that may be your emotions, your feelings, your picturization, whatever is there in the brain, that comes as a picture or emotion, so that that can also be possible.
Yes, ma'am. Thank you, ma'am. Another question. What are the sleeping habits of elite athletes?
Yeah, so it's like the same. Whatever the normal people, we are doing it the same way. The elite athletes also must do. So they are working for longer period of time during the day, and at night they need to have a proper sleep, because because of exercise. I have explained it in my slide. Because of exercise, the micro trauma occurs. The tears and wears are more during the exercise. So that has to be recovered. So they are spending more lot of energy, fuel, they are spending it, and that has to regenerate. So these things are only possible through proper sleep. So suppose a client or a sportsman is working for 4 hours or 5 hours of a day, and it is high, where the high impact is possible in the body, so that they need to have a proper rest, proper sleep, so that the recovery process takes place.
Thank you, ma'am. And another question: when we yawn, a person sitting before us also yawning. Why? Why it's happening?
Maybe it is a psychological reasons. She may be also tired.
Oh.
See, when I am tired, I don't have proper oxygen, so I'm yawning to get the oxygen back. Like the same, she may be also tired, so she will get that. That's all psychological.
Yes.
Yeah.
Then what is sleeping hours recommendation?
Sleeping hours. No, as I told you, I have shown you the chart also, right from the neonatal to the older adults. And as far as the older adults are concerned, 7 to 8 hours of sleep is very, very important. And you can increase it up to neonatal. So better you have 7 hours to 8 hours of sleep a day. That helps you a lot in bringing back your energy.
Yes, ma'am. Thank you, ma'am. Next question: why do kids talk while sleeping?
Yeah, that's what I told you. Talking during the sleep, talking is possible because it all the brain activity taking place during the sleep. So whatever the emotions are there in the brain, that reflects. So that no talking. So the children are not taking any alcohol or any kind of things, but even then that is happening because of those reasons in the brain.
So next question, ma'am. What is sleepwalking?
Yeah, sleepwalking. That is also one kind of sleep disorder where we will sleep and immediately somebody will get up and walk. So that is one of the sleep disorder where this can be eliminated through proper exercise, proper rest, and diet.
Yes, ma'am. Thank you, ma'am. And what is the difference between unconsciousness and sleep?
Yeah, see, there are stages, I said, 5 stages. First, light sleep, deeper sleep, and REM, dream. All these are stages. So, the types of sleep is REM and non-REM. These two things are having different kinds of stages. So, here, the unconsciousness is the deepest sleep where we are not knowing anything. So the light sleep, moderate, and those sleeps are all some kind of awakening, and what is happening also can be seen. But in unconscious stage, we will be not knowing any kind. So sleep is said to be, the whole lot is said to be sleep. Unconscious is one stage of sleep.
Thank you, ma'am. Then another question: how to overcome light sleep?
How to overcome?
Light sleep.
Light sleep. Light sleep means less sleep.
Yes, please. Yes,
Yes,
ma'am.
less sleep. And I've shown you the slide also. See, when there is a less sleep, there are so many issues comes in. So right from your appearance, right from your obesity, heart disease, even death can also occur because of the less sleep. Okay, so we need to have a proper sleep. That means 7 to 8 hours or 9 hours of sleep is complete rest is important to revive us back. That is why I said waking up in the morning and sleeping in the night. Again, the next episode comes in the next day. So if we want to bring in the next episode, we need to sleep in a pakka way. The light sleep will not help you in any way. So you need, if we want to overcome the light sleep, go for better. Again, these 3 things are making a vital role. One is sleep, another one is exercise, and another one is diet. So all these 3 are very, very important.
Another question. Sleeping in daytime is good or bad for our health?
Yes, I said that napping also should not be possible. Napping. See, that itself only for 10 to 20 minutes, I said. So during that time, if you are if you are sleeping, and the whole body becomes lethargic, and your system on the whole and the muscles become rigid, and you will be fatigued, and you will not get better sleep during the night. So night sleep is better. Why? During the dark time only the melatonin is secreted, so that helps to control many kind of activities in our body. So we are not supposed to sleep during the daytime.
Yes, thank you, ma'am. Another question, I think last question. How to overcome snoring sound?
Yeah, the snoring sound, because that also I told you in the slide that overweight and obesity, because of that this snoring comes in. So that if you are losing the weight once for all, it will go rid of, get rid of. Yeah.
Thank you, ma'am. Next question, last question. People who snore don't sleep deep. How do we overcome this?
People who snore,
No, don't sleep deep. How do we overcome this?
who said like that? People who do, you see, that itself, snoring and irregular breathing and apnea, these are all sleep disorders where we will not get sleep at all. All right. So where then the deepest sleep will come in. We are not having the deep sleep at all. Then how we will get the deepest sleep?
Yeah.
All right. So once we get sleep, only the deepest sleep comes in. So to avoid all those things, we need to maintain our body weight, and take good food, good exercise, so that all systems in our body triggers, so that a proper sleep occurs, and thereby these problems are get rid of.
Oh, sorry, ma'am. Another question, ma'am, please.
Yeah.
Some people used to bite their teeth. Why it happens?
See, that's why, see, our while sleeping, the deepest sleep, dreaming, the paralysis happens in our voluntary muscles. So that time somebody may bite also. I have not studied that, but the studies, we need to understand why it is happening, and that could be also possible. Physiological things are happening, so many changes of face, and so many movements are also happening in the face. So while one sleeping, if you could observe that, and there are so many movements happening in the body, especially in the face, and arm movements also. So during the deepest sleep, only our body is stands still. All right. But during other time, though so many activities could be possible, the brain activity is more.
One more question, ma'am. In what ways do snoring oil sold in the market?
See, everywhere marketing plays a vital role, and whatever is come out today, and people are wandering for it. I'm not for it. I'm only for natural things. As I told you, 3 legs. One is this, one is exercise, another one is diet, and another one is sleep.
So many
And
things are
don't
coming.
go for any kind of advertisement.
Yes, ma'am. Yes, ma'am. One more question, ma'am, please. People working in night shifts, what
Yes.
will they do to maintain their health?
Yes, definitely. No, the IT field, in IT field, they are all working in the night. So many people are working in night and daytime. They are cheating. They are cheating the natural sleep. So the natural sleep is during the night time we need to sleep, and daytime we need to awake. So the natural things are not happening. So there are so many health issues comes in. So to overcome that, anyway they are sleeping in the day, so that will not help them in bringing the melatonin secretion in from the pineal gland.
Thank you, ma'am. Thank you, ma'am. Ma'am, question from my side, ma'am. Last question.
See, one Saju sir from Bangalore, he has asked question.
Uh,
Japanese.
Japanese recommend napping power. what is your take on it? What is this?
Yeah, so I said napping in the morning. Saju sir, thank you very much for coming in for my session. And I'm so happy I couldn't see you. If could possible, you can come in through video. All right. And see, as far as napping is concerned, for Japanese, they suggest for napping. And I told you, if you are working in a working place, if you feel sleepy, you can walk, you can stretch, you can have water and do some sort of activity so that the sleep will go off. Even if you wanted to have absolute nap, you can go for 10 to 20 minutes. Even you can prolong it for 30 minutes. That's all. So that will help. Thank you, Dr. Saj.
One more question from my side, ma'am, please.
Yeah, please.
Especially during the night time while we sleep, muscle cramps occur only at the night time, ma'am, while we sleep.
During pregnancy time it will happen. Not for
especially the calf muscles.
Yeah. Pregnant ladies will have that calf muscle pulling it up. Because always the blood, the nutrient supply, everything goes to the womb. So that some kind of the electrolytes imbalance is happening, so that the pulling of calf muscles will be there, and immediately you need to stretch it up. Stand up and it will go off.
Thank you, ma'am.
Opposite way you need to stretch it.
The last question, ma'am, from Shakti. What are the steps to be followed for avoiding rolling of saliva from mouth during sleep?
Rolling of saliva. So that is also one way of when we go for deep sleep, somebody will bring out the saliva. So I do not know about this. So I have never seen this kind of people also. So maybe a good sleep will have a better effect on this.
Okay. Thank you, ma'am. Thank you very much for your...
And I would like to thank all the participants. I have seen so many people, including Dr. Sai Kumar sir from Maruti College, Dr. Mahendran Appukutti from Malaysia, and Rajit Kumar from Dubai, and Saji sir from Bangalore, and so many other learned members from various parts of the country and outside the country. And thanks for listening, all the participants. I thank each and every one of you from my bottom of heart, and thank you so much. Thank you once again.
Thank you, ma'am. Thank you so much, ma'am,
for giving me an opportunity to share my views on this sleep and fitness.
Thank you, ma'am. Thank you so much, ma'am, for your extraordinary and thought-provoking lecture regarding the unknown facts of sleep. Unknown facts of sleep, I can say, the role of sleep, how to adapt ourselves with proper sleep, then food fuel for sleep, duration of sleep, effects and benefits of good sleep, and good sleep cycle, and introduction regarding the interrelationship between sleep and fitness. So really, it was very wonderful session, ma'am. Thank you so much, ma'am. Wholeheartedly, I thank you. Please kindly accept our certificate, ma'am, your participation certificate on behalf of college and the Department of Physical Education, Health Education, and Sports. Thank you so much, ma'am.
Thank you so much for this immediate certificate.
Thank you, ma'am. Thank you, ma'am. And I thank all the participants, especially from the participants from abroad countries, and Tamil Nadu, PETs, physical education teachers, physical directors, coaches, trainers, and non-sportsmen, and others from various fields for a kind cooperation to conduct this webinar successfully. And I thank Mr. Ramakrishnan, the volleyball coach of Queen Mary's College, for extending his enormous support regarding the technical support to conduct this webinar session successfully. Thank you, one and all. Meet you tomorrow at 11 a.m. Thank you.
Thank you. Thank you.
Thank you, ma'am. Thank you so much, ma'am.
Thank you all. Bye-bye.